Sometimes I get a lot of patients who come in and they said to me, I have an inoperable brain tumor. I always say, you have a tumor. Every tumor is operable. The problem is that you have to understand what are the risks, benefits, and alternatives.
One thing is, just really being clear about whether or not this truly is an inoperable brain tumor. And that assessment is a team assessment by not only the neuro-oncologist, but the neurosurgeon, and not only a neurosurgeon, but the neurosurgeon who is best equipped here at Mayo Clinic to make that assessment. Instead of thinking about external considerations, I can think solely and exclusively about what's the right thing for that patient, and not for that disease even, but for that patient.
So I go back to the question, are tumors inoperable? And the answer is some of them may not necessarily be cured with surgery, but most tumors have a component of surgery that is necessary and is crucial to either obtain the diagnosis so that way you can appropriately design the therapy that that patient needs. When you are told that you have an inoperable brain tumor, your responsibility as a patient is always to question that diagnosis and seek higher level of expertise.
So inoperable brain tumors can be labeled as such via a number of different people. And so I think it's important to know that an inoperable brain tumor may be inoperable by the center or the clinician who is evaluating you at that time, but it doesn't necessarily mean that there's no one in the world who has the ability to safely operate on that tumor. And the reason for that is because a lot of these tumors are infiltrative, and when they infiltrate parts of the brain that you need to have the quality of life that you enjoy, whether it be language or movement or even areas of the brain that keep you alive and control your hormonal levels and allow you to breathe. Those are tumors that we're not going to be able to remove without compromising your quality of life, which is so important for us to maintain. And so in those cases, it may not be that we can remove all of the tumor, but it may be that we can at least obtain a biopsy. And in most cases, we would opt to obtain a biopsy in a manner that allows us to get enough tissue to figure out the best treatment for you as safely as possible.
One of the brain tumors that I study is DIPG, diffuse intrinsic pontine glioma. It lives in the brainstem of children. It becomes infiltrative with the brainstem, and this is something that you can't cut out, because to take the tumor out, you're going to take out part of the brainstem. And so that's clearly an inoperable tumor. We do biopsy it to confirm the diagnosis though, but you can't actually do surgery to take it out. And so there's areas of the brain that are very privileged, areas that do things that are very important, and the brainstem is certainly one of them. If we have the same location brainstem but have a different type of tumor like a pilocytic astrocytoma, this can be operable at times, where if we can get into the tumor, we can stay in it safely and not actually hurt the surrounding brainstem. The difference is the first tumor is infiltrative and actually interweaves with the brainstem, where the second tumor actually pushes the brainstem out of the way. And so those are the things that are very nuanced. And so some centers may just say, we're not going to operate on brainstem tumors, and they all become inoperable, where here it becomes, do we think we can do this safely? Has the tumor pushed the important stuff out of the way, and we can get to it with only taking the tumor out?
There are certainly some tumors for which the ability to perform surgery, or calling it inoperable, is somewhat in the eye of the beholder and the level of experience and skill that that provider has. At Mayo Clinic, we're very dedicated to providing opportunities for patients to obtain the care they need. But in some cases, we make a decision as a collaborative group to say, the risk of even doing that biopsy is too great. And so in that case, we're going to make the best educated assessment we can of what this most likely is and treat you empirically.
Our expertise ranges from the most amazing neurologists to the most extraordinary radiation oncologists to the most superb brain tumor surgeons. But in addition to that, and what makes Mayo Clinic so special, I think, is the fact that they all unite to put the needs of the patients first. So when a patient comes to Mayo Clinic, that patient is taken care of by everybody, not just the surgeon, not just the radiation oncologist, not just the neurologist, but also you have to consider that there's a lot of people like technicians, nurses, that are touching that patient, and they are truly the most dedicated and outstanding people in the world. And that's why I believe that every patient should seek their medical care specifically for brain tumors at Mayo Clinic.